Recording in progress.
It's echoing.
It's echoing? Okay.
Yeah.
What about this? Hello?
Comments.
What about this one?
Yeah, it's okay now.
Okay. Am I
Now, but
Yeah,
I don't hear my voice.
Are you able to hear my voice?
hello?
Hi.
Okay.
Am I clear?
Yeah.
Okay. But this one is not moving. Okay. Okay.
Yeah, okay now.
Bismillah ar-Rahman ar-Rahim. Assalamu alaikum once again and good evening. Number 13, a freestanding radiology service centers indicators include the measurement of patient wait times, timeliness of reports, timely follow-up on abnormal reports, and response time to urgent exam calls, as well as individual practitioner data. The information is collected by staff using various data collected tools. The quality management professional aggregates it quarterly and year to date. So reports it to the administrative and medical directors and disseminates the report to all medical groups and other providers with whom they have contracts. Use this information in answering questions. So this statement is asking to identify a missing step in the quality management process for a radiology service center. So which step is missing from this QM process? A, indicator development. B, data collection. C, analysis by peers. D, reporting. What's the answer?
It's analysis by peers.
Analysis by peers is correct answer. Yes, this is true. While the process includes the data collection, aggregation, reporting, and the dissemination, it lacks the peer analysis. While for the indicator development, these indicators like the patient wait times and the response times are already established. Then for the data collection, the staff collects all the necessary data using the tools. So this step is also included. And also for the reporting are disseminated to relevant stakeholders, fulfilling the reporting requirements. So the missing here is the analysis by peers. Okay, considering total quality management or the TQM philosophy and continuous quality improvement or the CQI process, who is most responsible for the effective implementation of quality management activities in the radiology service center? Letter A, quality professional and medical. B, council of organization. C, governing board. D, physician. This is, the statement is asking to identify who holds the primary responsibility for effectively implementing quality management activities in the radiology service center. Okay, what's the answer? It's
B.
It's a letter A. Quality professional.
Quality professional and medical.
Yes, because they lead and oversee the effective implementation of the quality management. Well, those three, the quality of organization, leaders provides the strategic direction, but does not oversee day-to-day implementation. Well, for the governing board, has the ultimate accountability, but delegates operational tasks to relevant personnel. While for the physicians, play a key role in delivering quality care, but are not primarily responsible for overseeing the quality management activities. Okay, number 14.
One
Yes.
comment, please.
Yes, Doc.
In this question,
Mhm.
the STEM question is radiology service center.
Yes.
not the entire hospital. And
Yes.
medical director is responsible for entire hospital, whereas not a special department.
Yes, yes, yes.
If this is right,
Mm-hmm.
then B would be right answer.
Mm-hmm. Okay. The quality professional medical director in the TQM and the CQI frameworks, the quality professional here provides the expertise in quality improvement methods, right? And the medical director ensures the clinical relevance and alignment with the organizational goals. So together, they
Mhm.
lead and oversee the effective implementation of the quality management activities. And not be, Doc, because this was your answer, right? Council of Organization.
Yeah.
And leaders that provide strategic direction, but does not oversee the day-to-day implementation. That's the difference of these two. Okay, clear, Doc?
Yeah.
Number 14, prospective review may be beneficial unless A, the patient is having elective or total knee replacement. B, the patient is being readmitted for bypass surgery following heart catheterization. C,
The screen is not visible.
oh, I'm sorry.
That's okay.
Okay, where are we now? C, the
Mhm.
patient was admitted through the emergency department for a fractured hip. D, the patient is a member of a managed care organization. What's the answer here? The statement is asking you to identify the situations or conditions under which a prospective review. So when we say prospective, a review conducted before a procedure or service is provided. So might not be beneficial. So what's the correct answer here? It's letter? It's letter C.
C.
Yes. The correct answer is letter C. Very good. Because prospective review, which evaluates the necessity of care before it is provided. And it's not practical or beneficial for emergency situations like a fractured hip admitted through the emergency department. Immediate care is required, and delays for review could compromise the patient's safety. While letter A is wrong because elective procedures allow time for prospective review, right? And ensuring the medical necessity and cost effectiveness. Well, for the letter B, readmissions can benefit from a review to ensure the proper planning and appropriateness. Well, letter D is incorrect as well because managed care often integrates prospective reviews to control the cost and ensure appropriate care. So correct answer is letter C. So number 15. Who usually makes the final decision regarding credentialing in a managed care organization? A, governing body. C, credentialing committee. C, quality improvement committee. D, chief medical officer. So this is quite
No,
tricky.
B.
This is quite tricky. Yes. What's
B.
your answer?
B.
Letter?
B.
Very good. Why is it so, doctor?
It's a credentialing,
Mhm.
not a government.
Yes, because the credentialing committee, this one, plays a key role in the reappointment process by reviewing the performance and qualifications of the medical staff. Though it recommends reappointment decision to the governing body, which makes the final decision, the governing body. But here, the committee significantly influences whether a staff member meets the necessary standards for reappointment. Why not letter A? Governing body. The governing body still has the final say, but the focus is now shifted to the medical staff executive committee for the primary decision-making role. Why not letter C also? This committee handles the verification of qualifications and credentials, but does not have authority over the appointments, and as well as the medical staff as a whole, because the medical staff provide input but does not make the final decisions about reappointments. So we are clear here. The answer is credentialing committee. Okay, final, the keyword here is keywords, final decision regarding credentialing, Radha. Okay.
Dr. Radha's voice is evoking.
I'm sorry.
Dr. Radha's voice is echoing.
Echo again. Oh my God.
Okay, hold on. How is it now?
Can Radha speak?
No, same.
Okay, how is it now?
Still it is.
Better? Is it better
Mm.
or still echoing? Hello?
If I can hear Radha, I can see whether she is echoing or not.
It is echoing.
Yeah, yeah.
Hello? Oh my God.
But your voice is clear.
Hello?
Your voice is clear, ma'am. From Dr. Nadeem.
So, is this okay now? Am I clear? Not
Yeah,
echoing?
your voice is clear.
Okay. So no more echo?
Yeah, your voice is no more echo. Only thing is I think my voice is echoing to Radha's voice as well to me.
No, your voice is very clear here to me, Dr. Gulam.
To me.
To you. Okay.
Close
So-
and open maybe.
Okay, so shall we continue or?
Yeah, continue, please.
Okay.
Yeah, only thing is we will see, just we will hear your voice.
But I want to hear your voices.
No, but
also.
if you participate, we disturb us.
The important here is our interaction.
Yeah,
You will give
but
the
unfortunately, the technical error is there.
But you are very clear to me, Doc. No worries.
Okay.
Okay, now we will resume. 16, who makes the final decision regarding reappointment to the medical professional staff in a hospital? A,
This is
governing
governing
body.
body.
Okay, B, medical staff executive committee. C, credentialing committee. D, medical staff as a whole.
Governing body, yes.
Very good. Okay, Radha, this is clear?
Yes, governing body.
Okay, very good. Next is 17. Okay, which of the following is an untrue concerning licensed independent practitioners or LIP in the hospital? Any licensed independent practitioner is potentially eligible for medical professional staff membership. B, licensed independent practitioners who are not members of the medical professional staff may treat patients. C, all licensed independent practitioners must be credentialed and privileged in order to treat patients. C, non-physician licensed independent practitioners practice with supervision within licensure limits. What's the answer?
Wrong answer is D.
Okay, the answer here is letter D. Okay. Why letter D, the answer here? This statement is untrue because non-physician licensed independent practitioners such as the nurse practitioners and the physician assistants are generally licensed to practice independently within the scope of their licensure. This is also untrue because non-physician licensed independent are typically not required to practice under supervision within their licensure limits. For letter A, B, C, these are all options that are true, okay? These three are true. For letter A, licensed independent practitioners may be eligible to apply for medical staff membership depending on hospital policies and their professional qualifications. Okay. Because the question here is, which of the following is an untrue statement? So these three, A, B, C, are all true. For letter B, non-members can still treat patients within the scope of their licensure, but they must be authorized by the hospital. Letter C, credentialing and privileging are required processes to ensure a practitioner is qualified to provide care within a hospital. So the untrue or the false statement answer is letter D. Non-physician licensed independent practitioners practice with supervision. Okay, number 18. Reappointment is reappointment to an organized medical professional staff generally includes all except A, reappraisal by uniform criteria, B, reappraisal annually or ongoing, letter C, review of current competency, and D, approval by the governing body. Reappointment.
It's B.
Okay, all except.
Yeah, it's
So
B.
meaning except here is the false.
Yes.
So letter
B.
B, reappraisal or ongoing. Because reappointments typically occur every
Annually. Yeah.
2 to 3 years?
Reappointment cannot.
Yes, reappointment. Typically occurs every 2 to 3 years, not annually. Okay. For letter A, uniform criteria ensures fairness in evaluation. For letter C, reviewing the competency essential for safe patient care and approval by the governing body. While letter D, governing body approval is mandatory. So letter B here is the answer, which is the false answer. Okay. So number 19, in a managed care organization or MCO, an appeal following a denial of care or benefits, A, may be reviewed by an independent external review process. B is a formal grievance filed by a patient. C is limited to insurance coverage issues. D may be reviewed by a patient advocacy group process. What's the answer? Okay. The answer here is letter A. Letter A, yes. Because in a managed care organization, appeals the following denials of care or benefits can undergo an independent external review to ensure fairness and compliance with regulations. Because external reviews ensure an impartial evaluation of the denial decision. For letter B, this is specifically refer to review processes and not grievances. For letter C, they can only involve the care-related decisions. For letter D, their role is supportive but not the procedure. So answer is letter A, may be reviewed by independent external review process. 20, community hospital has 4 urologists in this specialty, all of whom shares a practice. When a new solo practice urologist arrives and receives membership in the medical staff, and then concerns arise as to quality of surgical care, the best way to avoid conflict of interest issues is to A, have each urologist sign a confidentiality agreement. B, have each urologist review the cases and issues independently. Letter C, have only the one urologist who is head of the group handle the entire review. D, have a urologist from outside the group conduct the review to prevent bias.
D.
It's letter. When we say letter A, confidentiality agreement, this does not address the bias conflict of interest. Not at all. Okay. For letter B, this one, independent reviews by the same group members may still involve bias due to their shared practice for letter B. What about letter C? Okay, this one, delegating the review to the head of the group does not prevent the conflict of interest or ensure the objectivity. For letter D, the keyword
to prevent bias.
Yes, this is the answer. Have a urologist from outside because this one to prevent bias. An external review ensures the process is fair and unbiased. Okay. For number 21, Radha, is it clear to you?
Yes.
Okay. Number 21, the appraisal of individual practitioner performance in healthcare beyond minimum standards and criteria is known as A, continuous.
Let Radha answer.
Sorry.
And I will just participate.
Okay. No worries. Letter A, continuous quality improvement. B, intensive analysis. C, perceptive quality. D, peer review. Radha, what's the answer? The appraisal. This is the keywords here of individual practitioner performance in healthcare. The appraisal of individual practitioner. What's the answer, Radha?
This is
It's
peer review.
You're very good. Yes, it's peer review because this involves the evaluation of an individual practitioner's performance by other qualified practitioners to ensure to meet or exceed the required standards and criteria. Okay, for letter A, this is wrong because focuses on system-wide improvements, not individual practitioner performance. While letter B, intensive analysis. This is not a standard term used for practitioner evaluation. And for letter C, not a recognized concept in the healthcare evaluation. So letter D is the answer. Appraisal of individual practitioner performance is a through peer review. Number 22. What of the following is the greatest benefit of concurrent clinical review? What is the concurrent clinical review?
When the patient is within the hospital.
Okay, yes. It's the process of evaluating the patient's care and treatment while they are still receiving services during a hospital stay or an ongoing treatment episode. For letter A, ability to focus review on prioritized performance measures. B, ability to review outcomes of care and processes. B, C, timely assessment at the onset of care for continuity. D, timely intervention to reduce risk of adverse outcomes. Radha, what's your answer?
To review outcomes
Of yes. Letter D is the correct answer because this is the most significant benefit of the concurrent clinical review. Well, not letter A because this is a broader goal for letter A and not specific to concurrent review. While letter B is this is an outcome reviews that are typically retrospective. Yani after. The meaning of retro is after and not the concurrent. And what about letter C? Well, also this is important, but the main benefit of the concurrent review is preventing adverse outcomes. Okay, number 23. In conjunction with hospital credentialing, clinical privileges are granted. A, only to members of the medical professional staff. B, to all employees performing clinical procedures. C, to all licensed independent practitioners. And D, only to active members of the medical professional staff. What's the answer? It's letter C. Okay, to all, yes, to all licensed independent practitioners, because okay, these are who are properly credentialed and privileged by the hospital, allowing them to perform the specific clinical activities within their scope of practice. Why not letter A? Because clinical privileges are not limited to staff membership, but extend to all the licensed and independent practitioners. Why not letter B also? This is also incorrect because not all employees. Okay, like nurses are eligible for the clinical privileges, which are reserved for the licensed independent practitioners. Why not letter D? Privileges are not restricted to active members, but include all credentialed licensed practitioners. Okay, number 24. In the Xerox 10-step benchmarking model, the team seems to emphasize what quality improvement component the most. A, partnering collaboration. B, identifying customer needs. C, innovation. D, prioritization. So when we say identifying customer needs, so this is is this the primary focus of the Xerox model? This is not. So we will not include letter B. Why not letter C? This model focuses on learning from others, and which is not necessarily on creating new innovations. For letter D, prioritization is part of the quality improvement also, but not emphasized as much as the collaboration. The answer here is letter A, because this emphasizes the Xerox 10-step benchmarking model, emphasizes partnering and collaboration as it involves identifying what? Best practices, okay? And working with other organizations or teams. Okay. Number 25, in the large, healthy community medical group, one general surgeon has an 8% rate for both superficial and deep incisional surgical site infections for cases performed from October through March, 60% higher than the average for the other general surgeon in the group. In conjunction with the medical director, what should the quality professional do next? In this question, it is asking what actions the quality professional should take to address the significant higher surgical rate site infection, or the SSI rate for one general surgeon compared to their peers. So letter A, compare with local and national average infection rates. B, determine the surgeon's risk-adjusted case mix and practice patterns. C, compare with the rates of general surgeons in other surgical group. D, take cases to the peer review body. What's the answer here?
E.
Letter?
B.
Very good, Rasha. Yes, very good. Correct. Because before drawing any conclusions, it is critical to assess whether the surgeon's higher infection rates could be explained by factors such as the complexity of cases, patient demographics, or surgical practices. Risk adjustment ensures a fair comparison. While for letter A, this is also useful, but this step does not account for patient-specific or case-specific factors. For letter C, this may provide additional context but does not focus on the surgeon's individual case mix practices. And letter D, this peer review may be appropriate, but it's later. But analyzing the data first ensures the informed discussion. Number 26, clinical performance measures in disease management programs are based on A, standards of practice, B, clinical privilege criteria, C, clinical pathways, D, practice guidelines. What's the answer?
Clinical guidelines.
Clinical
Practice guidelines.
practice guidelines. Very good, Radha. Okay, this is ensuring the consistency and evidence-based care in disease management programs. While for letter A, these are general expectations, the standards of practice, but not specific measures tailored to disease management programs. For letter B, this determines what practitioners can do but are not used for measuring disease management performance. While letter C, this is incorrect because they are derived from practice guidelines and are not primary foundation for performance measures. Okay, number 27. Accreditation credentialing requirements generally include. So credentialing requirements. Okay, letter A, appointment to the appropriate category based on activity. B, current adequate malpractice insurance coverage. C, compliance with policies and procedures. And letter D, history of loss of or limitation of or privileges to practice. So meaning there are three which are true or correct and one is false. So what is
D.
Yes, it is the history of loss of or limitation of privileges to practices. The three ABC are all true. Okay. For number
Sorry.
Yes, Doc.
It is only one.
Okay.
Can you repeat this?
Accreditation, credentialing requirements. Okay.
Include. That's only one answer is right.
Literally include. Because these three, Doc, these three are all true statements. So meaning you cannot choose any of these true choices. So this is the correct answer, history of loss.
No, I'm sorry.
Okay.
Accreditation credentialing requirements generally include means only one is correct answer. Three are wrong answers.
Okay. Okay, Doc, I will answer you. For letter A, accreditation credentialing typically involves the assigning of practitioners to the correct category based on their practice scope, which ensures that they are properly classified for their roles and responsibilities. For letter B, the current adequate malpractice insurance coverage. This is true also. Malpractice insurance is a core credentialing requirement to protect both the practitioner and the healthcare organizations, ensuring coverage in any case of any medical errors. For letter C, this is true also, but more of an ongoing requirement in maintaining staff membership rather than a specific credentialing requirement. So letter D here is untrue as a general requirement for accreditation credentialing, while a history of privilege laws or limitation is reviewed during the credentialing process. It is not a standard requirement. It is
Can I escalate?
okay.
Because here mainly the question is keyword is accreditation.
Yes, accreditation,
Accreditation,
credentialing
yes.
requirements.
They mainly see the compliance to the policies and procedures rather than the appointment decision governing body,
Okay.
credential body. These are they have the respective categories and functions, but the accreditation like CBI and JCI,
Okay.
they mainly focus on the compliance.
Okay.
So in my view, it is the right because this question comes at only one right answer.
Yeah, maybe because of the statement is not clearly stated well.
Stated by.
Can I just add to that, Doc? It is the letter D is also considered as one of many factors during the evaluation of the practitioner's qualification, rather than a mandatory credentialing requirement, Doc. So that.
But in the CBI and JCI, randomly they take one or two files and they will see whether this physician have privilege or not. But in total, they will see the policies and procedures standards, whether this and other they give citations.
Yeah. Okay. Well taken for that, Doc. Okay.
Yeah.
But as the ABC, these are all true. And I explained to you.
Yeah. Okay, maybe I'm wrong.
Okay. Can we just focus of the statement that is not maybe clearly? We just give a chance. The statement here was not clearly stated, or the statement construction was not that clearly made. But maybe if it was constructed like all generally includes all except one, maybe that would be better. Yeah. So for now, I stick to my answer, which is letter D, Doc.
Okay.
Okay, Doc.
You remove this accreditation from advance, then the answer will be correct.
I'm sorry, Ladha.
You remove this accreditation word.
Accreditation.
The sentence is correct.
No, we cannot do that. Okay, so are we clear here? Ladha and Doc?
Yeah.
Okay. Thank you. So for number 28, the observation and evaluation of a new licensed independent practitioner, LIP, or LIP with newly requested privileges is known as A, the application progress, B, credentialing, C, proctoring, D, privileging.
C, proctoring.
Very good. Okay, this is the answer. Okay. So number 29, the basic philosophy of benchmarking is A, eliminating the competition, B, finding the best practice and incorporating it, C, getting all processes under statistical control, D, eliminating process deficiencies. What's the answer? Is benchmarking means
B.
Yes, best practice. Okay, that's the correct answer. Number 30, a child is experiencing repeated asthma attacks at school. Arrangements are made for her to be seen at the new clinic. The physicians utilize evidence-based treatments for childhood asthma accepted by their specialty. Such descriptions for specific clinical conditions are best known as A, standards of practice, B, clinical practice guidelines, C, clinical process policies, D, clinical pathways.
Clinical practice guidelines.
Very good. Clinical practice guidelines are evidence-based recommendations that guide the physicians in managing the specific clinical conditions. Okay, for letter A, these are broad professional expectations, not specific to clinical conditions. For letter C, this focuses on the organizational workflows, not treatment, the specific recommendations. While D, it is pathways that are step-by-step protocols derived from the guidelines, focusing on the care delivery. But the best answer here is the clinical practice guidelines. Okay, that ends our quiz for tonight. Any questions so far?
No.
Okay, so can we just move to